Aviva. It's amazing to have you on the podcast today.
Thank you, Megan. I'm so glad to be here. It's like actually kind of nice. I get to pretend I'm in Canada for the hour.
Yeah,
There's all kinds of
absolutely.
reasons
You,
that's
you
lovely.
are in Canada from where I'm sitting, so
Exactly.
welcome.
Thank you.
I always love to ask our guests how they got into the world of health, herbal health, natural health. Now, you've done a lot in your career,
Yeah.
starting, I believe, as a midwife and herbalist,
Actually,
and
I
are
started
now
as
an
an herbalist
activist.
and yeah, I started as an herbalist first. Well, kind of at the same time. It's a little bit of a wacky story. And I went to college when I was 15. I was living in the most urban setting you could possibly imagine, a New York City housing project. Although I had had exposure to plants, my best friend from middle school, her mom was Swiss. And so the first herbal tea I really ever consciously had was linden blossom tea, which she gave us linden blossom tea. And I had a cousin who lived in the Catskill Mountains, my grandfather's cousin, who grew herbs a little bit like some spearmint and things that I got to take home some plants and grow when I was a kid, but pretty much I grew up in this urban environment. My mom dabbled in health a little bit with some nutrition, but not significantly. But when I went away to college at 15, within a couple of months, I got exposed to herbal medicine, legal and not legal. Legal now in most places, but at the time, not so legal. And it was this kind of, I don't know, like aggregate composite vortex of introduction to cannabis and psilocybin, actually, and herbal medicine, like other medicinals at the same time, as I was also getting exposed to home birth midwifery and Chinese medicine and organic agriculture and food geopolitics, pharma, industrial, chemical complex. And I was just in love with it. I was in love with it all. And around the same time, I was also incredibly fortunate to meet a naturalist who taught me how to forage and how to make cordage out of plant material and how to start fires by friction. So there was this really incredible kind of back to the land experience. And also because nobody knew anything about herbs in 1981, except for maybe like some Northern California and Northern Vermont hippies, if you will. I mean, nobody was really using it. I knew like 3 things more than anyone else did. And so friends started asking me, "Hey, what about this? What about that?" I had a friend who broke their leg and with a composite fracture, and we're like, "Oh, let's do this." And his orthopedic surgeon was like, "Wow, I've never seen anyone heal that quickly," which may have been true and unrelated, but all those little moments added up to like, wow, this is not only ecologically and philosophically and spiritually amazing, but there's something to this as well. And that's it just kind of kept going from there. The weed and the psychedelics didn't kind of stay part of my active journey, but they're definitely something I'm very supportive of in appropriate usage. But all the rest of the herbs just have been with me ever since.
Awesome. Thank you for sharing that. It's so
Yeah.
hear everyone's journey into what we're doing and that excitement piece that I
Yeah.
think is very common, of course.
And so often it's like someone, right? Like we met someone. I had a someone along my path who introduced me to these things. And then I met the next someone and the next someone. And so the trail of plants was also a trail of really amazing people who just were on my path too, or helped me on their path.
Yeah, totally. So you've certainly been had a focus of women's
Mhm.
medicine, women's health for your whole career, of course, as starting as a midwife. And
Yeah.
I'm interested about this topic that we chose as sort of our focus today, because to me it feels like something that is just not a term that I remember hearing a lot, not even that long ago, and now seems to be everywhere. Maybe it's also my age and the algorithms that are
Yeah. It's
sending
funny
this
how
to
that
me.
is.
But perimenopause
Yeah.
is our topic for the day. And I'm curious to hear for anyone else who might be, newer to that term, what exactly, when does this begin? How does this differ from other parts of a woman's reproductive cycle? And
Yeah.
what are we looking at when we're talking about perimenopause?
Yeah. So menopause is defined as the day, basically, which is 12 months after your last moon, after your last period. So everything before that leading up to it is perimenopause. Everything after that is postmenopause. Perimenopause, or what is sometimes just called the menopause journey, that time leading up is extremely variable. Some women find themselves having a few skip periods, and the next thing they know, they're in menopause and barely notice a symptom. But for the majority of women, we experience symptoms noticeably anywhere from 2 to 8 or even 10 years before entering the actual menopause, where we haven't had a period for 12 months. The average international age of menopause is 51. So the average international age, or the average time for perimenopause, is usually starting in a woman's early mid 40s to late 40s. That can be variable too. Some women can start earlier because the average just means like, right, like the center of like when you put all the numbers together. So if some women are 56, but some women are 45, then those women who would go into menopause at 45 may actually start noticing perimenopause symptoms 3, 5, 7 years earlier. And symptoms, there are considered something like 30-something symptoms of perimenopause. The ones that we typically think of are things like hot flashes, irregular menstrual cycles, but vaginal dryness. Like, these are the big buzz ones that we hear about. But there are other symptoms that can be really subtle. And what's tricky is, especially like if you're going into perimenopause earlier, you're not necessarily thinking 8 years ahead that, oh, that brain fog, or that, frozen shoulder, or the digestive symptom changes, or a little bit of weight gain, or what, ADD kind of symptoms are perimenopause. You're just going to be thinking like, what on earth is going on? And most likely, if you go to most medical providers or even most healthcare providers, they're not going to be thinking perimenopause either. But there are a lot of women who are going through a lot of symptoms in that phase leading up to it. It's a really interesting phase because when we think about menopause, we tend to think about this big decline in estrogen, like we go from here to zero, right? Like estrogen just goes away. First of all, estrogen doesn't completely go away. We produce mild, like very small amounts of estradiol, but we produce a lot more of something called estrone, which is still estrogen that we're producing. We're just not producing it in our ovaries anymore. We're producing it in our adrenals and our peripheral fat cells, other places. But actually, in perimenopause, we have something called loop ovulation. We can have a couple of ovulations in 1 month. We can skip periods. But not only does estrogen go down, it can surge up. So women can experience 3 months where they don't have a period, and then all of a sudden, like the gusher, right? Or they can have 2 gushers in a row. They can have symptoms of things like breast tenderness, or heavier flow because of that increased estrogen. So it's also really tricky, and you can't really diagnose it on labs. Now, there's something called primary ovarian insufficiency. I don't like that term. We need a much better medical term. I don't like the term insufficiency with women. But what that is when our ovaries stop functioning much earlier. So under age 42, it's probably primary ovarian insufficiency if you're actually experiencing significant perimenopause or menopause symptoms. That can be due to medical issues. It can be due to surgical issues. It can be due to chemotherapy. And then some women go into menopause early, so they have like a premature menopause, but it's not primary ovarian insufficiency. They can be going into menopause even at like age 42. So it's quite variable. Some people have really significant symptoms, and people don't have much at all. And if you're going into perimenopause, you're having those symptoms, it's really important to figure out, is it that? Because right now, like if you go on the internet, you mentioned kind of being in an echo chamber of your own algorithm. I get it also. But if you were to just go on the internet, now we're kind of seeing, especially in the US, this kind of, well, we're seeing it in the UK also, but this cash cow phenomenon around menopause. Menopause is like a huge global commercialization opportunity. We're talking like a $600 billion industry that it's anticipated to be very shortly. And so part of what's happening too is everyone has been talking about menopause for a few years and has written their menopause books and got their menopause products out. And now perimenopause is the new frontier. So it's a completely natural phase of life. It's not something that we diagnose. It's not something that we fix or treat, but if some people are having a rougher go at it, then we want to make sure that they're getting what they need. But I do want to just urge people to be really careful, especially if you are in an echo chamber, if you're like reading about these things and you're following people on social media, you're going to now start seeing a lot more attention on perimenopause. And part of it's because it's not been talked about enough, but part of it is the more we pathologize something and the more people are anxious about it, the more they're also going to buy books and buy supplements and go for unnecessary testing. So we need to be kind of thoughtful about how we're approaching it.
Yeah, absolutely. And that's a really interesting thing you said about, well, the industry around supporting women's health, because that also comes contrasted from a time where we really didn't have a lot of positive women's health
Yeah.
support, or um, really systemically we're not giving a lot of time,
Mhm.
money. So now we there's been a big shift, but yeah, being
Right.
careful not to allow that to also kind of run away.
Exactly. Right. It's like this double edged, well, like two sides of a coin, right? It's like, it's so amazing that we're all talking about it and that we can't even have an echo chamber around perimenopause or menopause, that so many people are talking about it. And also, it's sort of like the flavor of the day, right? So it is incredibly important. We have to keep the conversation going. And we also have to remember that it's profoundly on trend right now. We're going to hear a lot about it. And then behind that, there is a substantial industry. And to just always kind of like, I guess follow the money is maybe one way to put it, or just like who's talking about this? What's their motive and goal? And can you take the positive information and the supportive information without becoming fearful and anxious and feeling like you have to take, 78 supplements while you're standing on your head in like an inverse position wearing a weighted vest? You know what I mean? It's like we have to be practical and
Yeah,
be careful about the buy, because we shouldn't have to buy to
yeah,
go through menopause.
yeah. Don't forget to eat your 400 grams of protein, and
Oh
yeah.
my gosh, I know, I know. I calculated my protein needs recently. I'm a moderate exerciser. I, do a lot of brain work, so, that takes a lot of protein too, and I'm petite, but I'm like, I don't know. I calculated based on 1.4 grams a day of protein, which is 1.6 is kind of a higher end for somebody who's pretty significantly athletic. So 1.4 is probably more than I need. And even at that, I was like 80 grams a day, like not any 120 grams or any more than that. Yeah.
Yeah, there's so much information out there. It can be really hard to know
Yeah.
what to pay, what to pay attention to, especially in this sort of world where we're taking in little bits of information through social media sources and the
Yeah.
sort of modern day technology. Really appreciate all the work you do, Aviva. You've written incredible books like
Thank
Hormonal,
you.
help us understand what's going on. As a herbalist myself, your botanical women's health textbook is one of my go-to all the time.
Thank you.
So excited to have you here. Maybe you can guide us through a little bit of what are some of those things that we can be paying attention without, going overboard, just when it comes to lifestyle, diet,
Yeah.
those things.
So to be clear, if somebody is in what I mentioned, primary ovarian insufficiency, or they're going into actual menopause really early, then they will need hormone therapy, because if you start menopause itself below like 42, you're really not going to get very important protection for your bones, brains, and heart without that estrogen. So in my medical practice, which is primarily herbally and lifestyle driven, I do prescribe hormone therapy for women who are in that circumstance. Also, for women who are really uncomfortable, really struggling, just, it's hard to cope, it's hard to function, or even if they're mildly uncomfortable and herbal therapy, lifestyle is just not their jam, they don't have the time, the energy, the bandwidth, it's just not what they're interested in, then hormone therapy can offer a really great option, as can hormone therapy if you try all the things that we're talking about and or we'll talk about, and don't get the results you want. But right now, if you were to go on the internet, I think that I mean, I don't know if you've experienced this, but I have found like the overarching message is if we don't take hormones, we're going to end up with dementia and osteoporosis, and our sex drive is going to be nothing, and our sleep's going to be crap. And like also claims around hormone therapy that actually don't even really apply to hormone therapy, but like haven't are not evidence based. I think what's really important is to know what the place of hormone therapy is. Like for women who have recurrent urinary tract infections, vaginal estrogen or vaginal testosterone can literally be a lifesaver, not just to prevent the UTIs, but all the complications and consequences that can happen with recurrent UTIs and hospitalizations and delirium, especially for women in their late 50s and over. But no matter what hormone therapy you do or don't do, it doesn't replace the really important lifestyle approaches, right? A lot of what we're seeing as symptoms in perimenopause and menopause aren't just a natural function of estrogen changing, progesterone changing, testosterone changing. Some of it is cumulative, what's called weathering, the impact of socioeconomic factors, lifestyle factors, diet, stress, trauma, environmental exposures, all of these factors that, and I talk about in hormone intelligence, gut microbiome disruption, chronic use of antibiotics that create inflammation or glucose dysregulation, insulin resistance, gut microbiome disruption. And so we still have to look at the root causes. Now, there are a couple of doctors online who say if you hear someone talk about root causes, run. And I'm like, no. I actually found a talk that I gave in the late 1980s on herbal medicine, and I talked about root causes. Like for herbalists, it's so natural for us to talk about roots and root causes. So I'm all about it. But what are all the other things that we still need to do to take care of ourselves? Like you could think your frozen shoulder has to do with declining estrogen, but you could also have joint inflammation from other factors, right? So then where does changing our diet, where does making sure that we're doing things for mobility like yoga and stretching, where does deep relaxation come in? Where does acupuncture or massage therapy come in? All the things that can contribute to inflammation. And where do our botanicals come in, right? Whether it's boswellia or devil's claw or turmeric or any number of botanicals that we have to directly address inflammation, or botanicals that we might use to support gut health or to support sleep. And so, sleep is a big factor that increases our perception of pain. So there's so many other things that we want to think about. And the beauty of, I think, awareness around perimenopause right now is to see it not as this pathology of like, oh shit, now I'm heading into menopause and I've got to do all these things, but like, okay, I'm at another portal in my life, right? And I've got a number of years before I actually get to the door, but I'm on this path and I can see the door in the distance. And now's the opportunity to actually support my bone health, to support my gut microbiome, to reduce inflammation, to bring in really intentionally and purposefully any things or habits or practices or lifestyle ways that you've been like, ugh, I can do that later, right? Like whether it is making simple dietary changes, it could be, less sugar, less alcohol, more healthy plant-based foods and more protein. It could be bringing in that really regular exercise, but also weight bearing, right? These are things that we can do now as an opportunity to improve menopause as an experience later, but also long-term health span, right? Like not just our lifespan, but our health span. How long? 50% of women in the United States, at least, are on at least two pharmaceutical. 50% of women over 50, sorry, in the US are on at least two pharmaceuticals. And a lot of women are on a statin for cholesterol, on a blood pressure medication, on something for their blood sugar, and then often something for sleep or depression or all of the above. A lot of times they're on something for their digestion. So what can we do now to address and prevent those symptoms so that we're not at risk for those conditions later? What can we do to take care of our heart health? It's not hormone therapy, it's lifestyle.
Yeah. Yeah, I mean, there was So much happening with the hormones, of course, and it sounds like these shifts really affect a lot of different
They do.
of our body. You touched a little bit on it, and I know it's very complicated how hormones work in the body. I'm not expecting a huge class, but what is really the main sort of hormones that are shifting during this perimenopause period?
Yeah. So just to take a step back and look at estrogen. And there are several kinds of estrogen. Estradiol is the really potent one that we're producing through most of our reproductive life cycles, whether we choose to have children or not. It's still called the reproductive life cycle. Probably need a better name for that too. Our hormonal arc on journey. Um, and then during pregnancy, we're producing more of something called estriol, and in menopause, something more called estrone, as I mentioned. Estrogen impacts pretty much every system in our body, right? We have estrogen receptors in our brains, in our brain, in our bones, in our heart. They're everywhere. And not only does estrogen impact all of those systems and organs, but estrogen is also intimately tied to our serotonin levels, which is the neurotransmitter that keeps our mood elevated. Estrogen is intimately tied to our blood sugar regulation. So there are a lot of other factors that are influenced when estrogen starts to go up and down and up and down, and then finally down, 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 and down. So that's, kind of unequivocally like the queen of the hormones. The other thing with estrogen is that it's one of these, like, you don't realize what you've got till it's gone. Um, it just influences so much of how we feel. And we know that as women going through our menstrual cycles, like, we feel different at different phases of our cycle. And estrogen partly keeps us feeling literally, but also kind of emotionally and psychologically juicy and kind of sexy and creative and engaged. And then next to that, we've got progesterone, which starts to decline in perimenopause and menopause as well, and especially in menopause. And progesterone also influences so much of how we feel. Progesterone is actually a deeply relaxing hormone. It helps to regulate our sleep and our mood, but it also influences and it kind of peaks after our ovulation. So it's a really important part of our sense of fertility and creativity. Um, and then testosterone starts to go down too. Although what's interesting is estrogen and progesterone go down more. So then we become actually slightly relatively testosterone dominant. And so it's interesting too when you think about estrogen and progesterone are these hormones that we're producing like a lot of in pregnancy and in our luteal phase. They give us that sort of, like I was mentioning, juicy, fertile, something, something going on. But they're also hormones that deeply connect with oxytocin that give us a sense of connection and nurturing and deep attention to the needs of others. Whereas testosterone really gives us a lot of drive and energy. And so when we become a little more testosterone dominant, a lot of women, especially in menopause, start to say things like, yeah, I don't feel quite as nurturing or like worried about what other people think about me. And yeah, my kids are getting grown and I'm ready to kind of do my thing and travel and launch that career or go back to school. And that's probably partly a little, and people also get a little bit like more irritated and irritable, even by the people in their loving circle at home. And that's probably significantly not only due to lack of sleep and other things, but due to these hormonal shifts. And then thyroid hormone may change as a result of these other hormones changing. Lack of sleep may actually drive our cortisol up and then ultimately down. So that can have an impact on our immunity, our sense of well-being, how well we're sleeping. It can influence weight gain around the middle. It can influence sugar cravings, all kinds of things. And when our thyroid function goes down, that can influence our cognitive function, our mood, also weight. Our hair can get drier and thinner. So there's so many interrelated kind of webs here that you can't really just tease out one, but this is all the kind of milieu and soup that we're in, and they're changing all the time until they finally you get to a couple of years post-menopause and things start to settle out more.
Wow. It is
But
it
it's a new normal, right? It's not just settling out, it's settling out to a new normal with lower levels of all those hormones. So you're really going through a whole new experience of how you are in your body and in your mind, cognitively and in your life. Like, we know that some of these hormone changes in menopause are linked to increased risk of ADD, increased risk of alcoholism, even if you've never been a drinker, increased risk of depression, but also increased risk of some other psychiatric problems. So it can have a huge impact on a lot of our lives. We know that the changes in hormones can lead to changes in cognitive function. Now, it's not change in intelligence. I want to be really clear. Intelligence doesn't change, but the way our brains work may shift. And then if you add to that lack of sleep, a lot of women are leaving the workforce because the workforce isn't accommodating the cognitive changes that women are going through, which I find fascinating. It's like I'm working on a book right now, and I've always been like a high content creator, like fast, clear, able to manage multiple projects at one time. And that has totally shifted for me. It's like I need to like really focus, not have too many tabs open, literally and metaphorically, and really dive in. But I'm finding that my storytelling hasn't shifted at all. And I sometimes think, well, I'm 59. If I were living more traditionally, 200 years ago, as a 59-year-old woman in my community, a midwife, healer, herbalist, I would be a storyteller, right? I wouldn't be doing so much of the linear stuff necessarily. So, how does evolutionary biology also impact and come up against a culture that doesn't support us? And how does that also worsen our experience of this transition?
Mhm. Yeah, it's, also interesting to think, I mean, anyone who experiences a menstrual cycle knows how hormones can
Yeah,
really affect the way we are, the way we see ourselves, the way we present ourselves to the
100%.
world, who we even think we are. It reminds me a little bit of when as we've discovered really how much our microbiomes inform, our own behavior. It's like our hormones also it can almost feel like, are we even in control at all of who we
Yeah.
between all of these things going on? And of course, it's all a part of us and it's pretty incredible. But I'm curious to know, of course, as a herbalist, in my training, we don't match herbs to symptoms. However, the person, their individual
Mhm.
constitution is always important, but there are herbs that are general great tonics, supports, things that can help to support hormone balance. What are some of your favorite for this?
Yeah, I agree with you. I mean, ideally and sort of philosophically, we're going to use botanicals that support the whole person. And that's where we're looking at, what can we do to support the microbiome nutritionally and botanically? What can we do to support sleep nutritionally and botanically and lifestyle? But there are times when a woman is just having straight up hot flashes that are keeping her from sleeping, or she is just having, you know, recurrent urinary tract infections, and she doesn't necessarily want to start on vaginal estrogen or vaginal testosterone or DHEA. And so, um, in general, for kind of like a daily nutritional, botanical support, I I'm a food first person. And so, as much as you can start to incorporate just like teas into your life, the only things I would give the caveat is try not to drink tea within a couple of hours of sleep, because then if you're having a sleep problem, you'll wake up to pee. So then think about tinctures. But I'm just a huge fan of bringing herbs into the diet to start with, whether it's garlic, dill, turmeric, cinnamon, ginger. I pretty much have ginger in something almost every day. And, when we're talking about like preventing inflammation or reversing inflammation, when we're talking about helping keep blood sugar steady, that's a great place to start. And then adding in some simple herbal teas. And it can be anything you love. Right now, I live in Western Massachusetts, and we're talking, at the end of September, and I just went and harvested a bunch of rose hips yesterday from my rose plants, and I just came in and I made a rose hip and ginger and peppermint tea, and it was delicious, and just, have a pot of that and just sip off of that. Think about your nutritive herbs like nettles, and don't just think of red raspberry for pregnancy, it's a great uterine tonic. So if you're having heavier bleeds or irregular bleeds, and then those irregular bleeds when you finally do bleed are a heavier flow, think about having some red raspberry and some nettles, right? These are all just great daily ways to add herbs to your life. When it comes to perimenopause and someone experiencing symptoms, it really kind of depends on what the symptom picture is. But one herb that I go to that we tend to think of for fertility and menstrual cycle regularity, can you guess what I'm thinking?
Vitex?
Yeah. I think it's a great herb for those erratic cycles, the ups and downs. We know that it's mildly estrogenic, mildly progesterogenic, so it's gonna support that hormonal. I don't like to say balance because hormones are I think when we say hormone balance, we know what we mean. We mean something a little bit more, kind of like visceral, right? Like that feeling of feeling steady throughout the waves. But hormones are not ever balanced. They're waving all the time. And so Vitex can be really helpful for that. Vitex, for people who are on the cusp of perimenopause symptoms but want to kind of nurture their ovaries a little bit, might be really great for keeping the cycles going a little bit longer. There may also be some benefits to Vitex for sleep, for what are called vasomotor symptoms like hot flashes. So I like to include it as part of the picture. I usually use it as tincture. You can use it as capsules too. And then my all-time favorite herb for every phase of a woman's life, except for during pregnancy, because it's contraindicated, is motherwort. So for anyone who is kind of cognitively or emotionally struggling with sleep, mood, hot flashes, palpitations. In fact, the German Commission E approves of Vitex for vasomotor symptoms and palpitations associated with perimenopause. Did I say Vitex? I meant motherwort. Sorry. So motherwort to me is like a great go-to. You can take it for spot anxiety, a panic attack. You can take it for sleep. You can just take it for tension and irritability. And it's also a bitter, which is great for digestion, and it's a great uterine tonic. When it comes to symptoms, then I start to think about like if somebody's having really significant hot flashes, I might incorporate Vitex, hops, and sage together. I will still use black cohosh. I know the data is a little squidgy on how effective it really is, but it's so classic that I will often still include it in a protocol. The thing with the hops and the sage is that they are estrogenic. So if somebody has a history of estrogen receptor positive cancer, they need to check with their healthcare provider before they jump on those, but you can still use the others. Um, what are some of the others there's like so many, but those are some of my core day to day that I use in my practice or even myself. And then sleep. I mean, ashwagandha, passiflora, lemon balm, all great for sleep. Reishi mushroom, wonderful for sleep. Adaptogens, just the gentle adaptogens for kind of going through life's waves and changes can be really helpful of that stress resilience.
Mhm. Yeah, that's another thing I was interested in hearing your perspective on. Also, motherwort is a favorite, of
I
course.
love motherwort.
That one, that was one of my first herbal loves. And
Mm.
speaking of that, adaptogens, stress, also the cycles. So we are living in a challenging, let's say, structure of the world that is not really supporting the cycles of a menstrual cycle or hormonal cycle
No.
we typically go through, which I know can add extra stress from losing work due to having, pain during menstruation
Yeah.
or difficulty sleeping during perimenopause or any of these various symptoms that can really be quite debilitating. And so what are some things we can do to, manage this sort of I don't even know what you call it. It's a mismatch that
Yeah, yeah. I mean, there's a term for it. It's called an evolutionary mismatch. So you're right, spot on. The concept of an evolutionary mismatch is that, we've spent eons, um, with our cycles intact the way they are in natural environments that allowed us to stay in touch with our circadian rhythms, with not being on blue light and computers and all the physical like triggers that affect our menstrual cycles, but then also on top of it all the really significant stressors. And it's not that our predecessors and people, 100,000 years ago or 1,000 years ago didn't experience stress. They obviously did. But, it tended to be more episodic, more up and down, like there would be an intense, hunt or a threat or, the need to find food, but it wasn't this chronic bombardment that we have now in this kind of endless way, um, along with living in an environment that is just not aligned with healthy rhythms. And also, we often live quite estranged from each other, right? We're not necessarily living in villages, tribes, and communities the same support that we might have had in the past. And so all of this kind of bumps up against these evolutionary rhythms. And so there's a mismatch between what we have been primed for all these millennia to live with and in and through, and what we're actually facing now. And it's just a little like, I don't know, it's extra, right? It's off the chain to
Right.
what our biology is expecting. And it really can have a huge impact. And when I think about, when you were saying just a few minutes ago, women know this through their menstrual cycles, I think about women's life arcs, right? Puberty, pregnancy, if someone becomes a mother, postpartum, and menopause. And the thing with puberty is that it can be really challenging for many young people, emotionally, physically, all the things. Yet it is associated with a really positive transition, right? Even though we might be scared of puberty or it's uncomfortable, we're becoming adults. And then when you're becoming a mother, if you choose that or are able to experience that, you're becoming a mother. And that's highly valued in cultures all around the world. When you're in perimenopause, entering into menopause, not only are you going through all of similar or kind of corresponding physical, emotional, psychological, and spiritual shifts that you go through in these other cycles and little actual brain remodeling, but what's on the other side of it, right? We live in a culture where on the other side of being, let's say, 48 is Botox and face work and um, being old and being aged out. Like, I think as herbalists, we're kind of fortunate. I remember sitting on a porch at the Medicines from the Earth conference. I mean, like 25 years ago, and I was sitting with a bunch of folks, and it was like Cascade Anderson Geller and Amanda McQuaid Crawford and Chantal Cabrera and Mary Bove and me and Leslie Tierra. And there were a bunch of the guy herbalists there too, the men herbalists there too. And we were kind of joking. It's like one of the
Right.
few professions where you become more and more valued as you do get older, right? Like there's a wisdom culture within our tradition, that crone or queen and crone culture, that wisdom of the like the mantle of the elder is respected and revered. But out there in the rest of the world, it isn't always so much. And so you're going through these incredible physical, emotional, and psychological changes, and also facing cultural values that are not positive around women and aging. And you're like looking at mortality in a different way. So it's sobering. It's different than puberty and it's different than pregnancy and postpartum, where there's some kind of like celebration of it. And I think we deeply, deeply need to bring ritual and celebration and honoring back into this phase of our life, not anti aging, not, exercising to be strong, which to me is important, but is kind of like it's like the way the bikini body became the yoga body. I feel like people are saying, "Oh, don't be thin, be strong," but they're often thin people saying it. Do you know what I mean? It's like, okay, so what are you really telling me here? Like, what's the actual hidden message? How do we shift that into something that's new and deeply feminine and deeply wise. That's what I'm all thinking about these days. So,
Yeah, that's incredible. And what you said about your own experience of storytelling too reminds me of something I heard. And it's about that there's very few species that actually the females have a significant life period post their reproductive peak.
basically us and whales.
Yeah,
Yeah.
incredible.
Yeah.
I found that just fascinating, and it's yeah, that is the space to step into being the wisdom carrier and the
Yeah.
wisdom sharer, right? And we really don't have a lot of support. I see this coming back um, these days. I do with younger people getting interested again in that information and that knowledge, where there's
Mhm.
a couple generations that were very much separated from that. And it's interesting. I find that in my own experience as a herbalist and teacher, many of my students are older than me.
Mhm.
That is it can be a bit of an odd
Yeah,
dynamic.
no, I remember being
Feel that.
27 or 28, and I had been invited to North Carolina to give a weekend intensive on menopause. And there were about 30 women in my class, all menopausal age. And they were nurses and midwives and, just women there for their own interest. And, I started out I started out apologizing. I said, "I don't have the lived experience you have, so I'm gonna learn from you, and you tell me what you need me to talk to you about and with you about and share with you, and I'll share from my knowledge bank, and I'll share from the wisdom that I have around other women's life cycles." And they were like, "Aviva, thank you so much for that, but we would much rather hear what you have to say than like our male doctor who is never going to go through menopause and is totally clueless and tone deaf." So I think yeah, we're here to share the information, even if we don't have the lived experience yet. But I agree. It's like we're seeing all ages. But but for so many people, like for us as herbalists, I just want to say herbalists every time I talk to my friends in the UK and Canada. Us as herbalists, we again, I think we live in a culture where ceremony, ritual, nature, rhythms. I mean, even just the rhythm of me going out to pick rose hips yesterday, right? It's like, oh, it's a time of the year when I pick the rose hips. So it had me connected to the cycles of the land I live on and plants that way. A month ago, it was the elder, right? Like it's whatever it is, we have that natural connection. So many people's connection to botanicals out there in the rest of the world is through pills and packaged products. And a lot of the herbal products that are being sold by menopause influencers, they're people who have no connection to plants. They're private labeling generic products with the kitchen sink thrown. I'm like, I was asked to I am being asked to be a potential like medical consultant for a company that is naturopathic driven. It is their packaging, their branding. It's like it's beautiful. And I was like, well, send me the products. And I got the products. And first of all, one of the packages is like, it's got to be a 2 pound bag. I haven't, it's either a 1 or a 2 pound bag of powder. Now, you and I know that once you open that bag, it's gonna get exposed to air, it's gonna oxidize. How good are those powders gonna actually be in 2 months, right? That it's gonna take to get through that bag. But then I was looking, this is like a daily nutritional powder for women, and I was like, "Why is there slippery elm in here? Why is there this in here? Why?" It's like as if the kitchen sink was just thrown in there. And when you have like 40 or 50 things in a product, how much of any one thing are you getting that's actually medicinal? So it's like I'm constantly urging people, get your herbal medicines from people who are herbalists, companies that are run by herbalists, that the formulation is truly intentional, elegant formulating, not just people coming along with another product and throwing the kitchen sink in or throwing weird ingredients in just to make it look like a unique product. You know what I mean?
Yeah, there is it's a again, double-edged sword, or is it
Yeah.
same coin of it's so nice to see so much knowledge about herbs being out there, interest in herbs,
Yeah.
but still is a bit of a wild west when it
So
comes
much.
products, things that are pre-made. And yeah, yeah, good advice. Yeah. And then people are still not fully even understanding too the difference between a herbalist and any other type of
Right.
holistic practitioner as well, which
Yeah.
is, I think,
It's complicated and unfortunate. I think you all up to the north of us are much more organized as herbalists. And every time I've come and taught, I've taught in Toronto and Montreal many times. There's just like a very high level of herbal education. We have amazing herbalists here and we have amazing herb schools here, but we don't have any consistent kind of guidelines or regulations. So even in who is an herbalist is a wild west. And partly because of that, herbalists as a profession or herbalism as a profession hasn't really made its way into the mainstream. So what we're seeing here in the US is a lot of herbal product companies are not run by herbalists at all. They're really just product companies, right? It's kind of like cannabis here in the US. We've got dispensaries on like every block, but how many of them are people who actually have herbal knowledge or deep relationship to cannabis? So sadly, so much of it is commercialized, and then also the quality isn't always there because, you and I know, and our listeners here know that the medicine is what you start with is what the efficacy of that medicine is going to be. And if you're starting with poor quality ingredients or not the right preparation, right? Like most people aren't using tinctures, which to me I see a lot of tinctures behind you there. They're still the most efficacious of the products compared to like powders, capsules, or pills. So
hmm Yeah, and also being more when you're extracting more, you're valuing the plant more.
yeah.
You're able to use less. Yeah, I'm a tincture user. I use spagyric tinctures myself. I've been making
Oh,
those
nice,
myself,
nice.
so even maybe a little more efficacious. So even less plant material, although there's other,
Yeah, I'm a
less-
tincture user too. I mean, I love teas for beverages. I love teas and infusions, decoctions for water-based medicines when I need them. And I do use capsules and pills in my practice, my medical practice, because sometimes it's the way that people are most familiar with. People
yeah.
are find tinctures foreign and weird or don't like them. But I actually just recently I gave a patient a tincture and she was like, "Oh, this is awful tasting." And I was like, "Well, try this. Put it in like a large amount of sparkling water. Just put your daily dose, shake it up, and then sip it that way." She's like, "Oh my gosh, this is so good. Now I look forward to it every day." So,
Oh, yeah. I know I always have to remind myself, not everybody has the palate of a herbalist. So
totally.
be aware when giving friends and family or clients or patients anything extremely bitter or
Yes, like motherwort. Yeah.
strong flavors. But um yeah. So Aviva, you are in a really interesting position as both a medical doctor and a
Yeah.
herbalist who's had a lot of experience. And I know our health systems are different in the States and Canada, where you practice in the States,
Mhm.
here in Canada. But there are similarities in the sense that a lot of the modern medical community is not very well educated or even, believe in or see any value in herbal medicine. So, how do you recommend someone, let's say a woman who wants to use some natural herbs, diet stuff, any
Yeah.
of these other options, and is talking to their doctor, what are some ways that this can be approached? Because that can be a difficult conversation to have.
Absolutely. And adding another layer to it, the Menopause Society, which is a big menopause education organization for professionals, came out with a statement a couple of years ago, maybe it was last year, but that they don't endorse any botanical products for perimenopause and menopause. Yes, a little bit to acupuncture and massage therapy, some of these external therapies, but basically no across the board to herbs and then any supplements other than like, if you need vitamin D or a calcium, if you're not getting enough from your diet. So there's even like a little bit of an uphill battle around that, when people are menopause educated in the US, which isn't that many people, but it's there as a statement. So one of the things I think is really important is to the extent that you can build a relationship with your provider and have a provider that is at least aligned with and open to what you want to do, and someone who's willing to help you sort out like fact from fiction and data from hype. I have a wonderful primary care provider. She's lovely. She knows nothing about natural products whatsoever. She can do my PAP every 5 years, and if I ever have something I wanna check in with her, I can check in with her. But, the thing with her is that if I were to say that I was wanting to do something or try something, she would never say like, "That's ridiculous," or, "Where did you get your education from Doctor Google?" She'd be like, "Oh, that's interesting. Tell me about it." And I know that if I were a different patient of hers and I asked her about it, she'd say, "Well, let me look into that for you." And that's really what our medical provider should be doing, to the extent that as a physician, I have a crazy amount of continuing education that I always have to do, medical license renewals, board renewals, and I was prepping for a board review exam that we have to, like, redo ours every 10 years, it's a whole thing, and then every 3 years, like, a lot of CME, and I was prepping, and one of the questions that came up in the sample questions was, a patient comes to you, let's say she's a 48-year-old woman, she's got moderate depression. She comes to you and asks you about St. John's wort. The correct answer is, and it was something like, that's dangerous. A, that's dangerous. B, that doesn't work. C, that's ridiculous. Or D, let me look into that and get back to you. And the correct answer was D, let me look at that. Let me look into that and get back to you. So having that relationship with our providers where we can say to them, hey, like where we're building trust and where we are confident enough to express what we need. Now, if you have a medical provider and, you guys, I think you kind of have, because of your wonderful insurance, national health care, you may have a little bit more limitation on who you can actually go see as a provider, whereas we may have a little bit more freedom here. Depends on, what your resources are. But you can have more than one provider. So you can have your MD if you need to, and if your MD knows nothing about botanicals, but you can't switch and your MD is even a little bit negative about botanicals, you can have a licensed naturopath who, you trust. You can have a nurse practitioner. You can have an herbalist as an adjunct provider if you're confident with their training. So don't feel like you have to only have one person, but build a team. And then I think the other thing is just know where you're getting your information from. Like, is the information that you're getting based on the best evidence? So you may have a doctor who's like, that's ridiculous, because sometimes stuff is ridiculous, right? I mean, I can think of patients who have been to other providers, including other MDs, who have come to me on protocols that I am just like, in my mind going, that's nuts and ridiculous. I would never say that. And I'm like, okay, let's unpack this. Let's look at the evidence. Or I might just say, like, there's no evidence for that, and it's known not to be safe. Colloidal silver is an example of that. I actually had a patient who had type 1 diabetes, was having really significant symptoms, and came to me after a series of integrative and functional MDs where she was put on all kinds of like supplements. She had been given all kinds of tests. She was put on colloidal silver when she actually needed an insulin pump. And so I was, it was a little odd. I was the one coming off as like conservative, but like, you need an insulin pump. And she did. And she recovered beautifully from her symptoms and went on and, is great. But so knowing where you're getting your information, and just because your medical provider dismisses it, don't just assume they're dismissive. Like, have them dig a little deeper with you.
Mhm. This is really, really special and important things to hear, I think, in this day and age where there is such a line drawn for a lot of folks and within our society about what we believe. And if you're on one side of one thing or the other, and I've seen this in my own experience in the natural health world of some folks just shunning anything modern medicine to go to saying, natural is always better.
Yeah.
And then there's folks who go the other direction completely, right? And saying, oh no, all those plants don't work, which crazy to me because that's literally a food we eat that we know has
Right.
benefits.
My favorite is that doesn't work and is dangerous. And I'm like, well, if it doesn't work, what is it actually doing? I mean, okay, if you're not getting medical care that you need and it doesn't work and it's different, but like this, like, yeah, that doesn't work. It has no strength and no efficacy, but it's dangerous because it's so strong. I'm like, get your story straight. So
Yeah. Yeah, that's a classic one. I remember, Terry, who's the
Yeah.
director of college, in one of his courses about herb and drug nutrient interactions, he said, "When I started, they said the herbs didn't work, and then 20 years later, they said they were all dangerous." And he's like, "I can't keep track of it all."
I know, it's so true. It does give you a little whiplash.
Yeah, yeah.
Yep.
That's, I think as any practitioner knows that what works is always worth investigating. What
Mhm.
is gonna work for that client, patient, that person that's in front of you, and
Yeah.
if it's outside of your scope to, give them guidance to find someone who can help.
Mhm.
And that's something that I hear most folks that I know that are practicing at a clinical level when it comes to herbs, understand this and know this. And I'm curious, in your own experience, in your training to become a doctor, if that any of that is touched on, talked about, at least when you were going through that.
Girl, I went to a small class on herbal pharmacology. I was so interested in it, and the teacher wrote we're, like, sitting on in a small room. It was like a little breakout session. Person was a pharmacologist, not an a pharmacist, not an herbalist, and literally wrote echinacea on the board. Ekainasha. And I raised my hand. I was very polite, and I was like, "Excuse me, it's actually spelled ECH." And the person just looked at me. They were like a guest teacher. They didn't know me at all. They were like, "And who are you to say this?" And I was just like, I literally said, "I am someone leaving this class." The person was so rude, and everyone just kinda, like, laughed, but I was like, barely. No, it was not touched on at all. And for me, when I went to med school, I went to Yale. I mean, they were so receptive to me being there. Sometimes it would be like, "Aviva, could you go talk to this particular patient? She's got blood clots and she stopped taking her Coumadin and she is using garlic instead. Would you be willing to go talk with her?" Or conversely, it would be like, one great experience was, one of my preceptors when I was in residency, we had to give classes periodically. So I had given a class on botanicals for common clinical, common primary care things that were evidence based. And one of the ones that I talked about was horse chestnut for varicosities, which is used widely in Europe as a medication. And maybe 3 months later, one of my attending professors came over to me and said, "Hey, Aviva, do you think that horse chestnut would work for a diabetic patient of mine? He's got severe varicose veins in his legs. He's about 300 pounds and he's really uncomfortable." And I said, "I don't know, that might be a stretch. Like, we might need to think about something different." And he said, "Oh, I was just curious to what you think. I heard you talk about it a few months ago and I put him on it and he has had amazing results." And I was just like, "Oh, that's hilarious." So, um, there was huge receptivity, but in general, it's not covered at all. In my 4 years of medical education at Yale, there were 2 classes on nutrition. One was canceled because the professor had something else that he had to do that day, and the other was me giving a class, to a small group on public health and nutrition. It's just not talked about.
Mhm.
And it tends to be judged. I mean, there's still a lot of negativity, like this almost kind of woo-woo, and partly, I think people don't know the difference between a well-educated, well-trained herbalist and all the hype and false claims and adulterated products that we hear about and read about, or contaminations. People hear those stories, and that's what they assume herbal medicine is.
Mhm. Yeah, that is interesting too, because those sort of horror stories get sensationalized.
Yeah.
Also, being unregulated as practitioners is an interesting
Yeah.
place to fall, which I know there are absolutely benefits of that. Personally, I feel the benefits
Yeah.
outweigh, the trade-off in some ways, although it does it sounds, that sounds a little sketchy when you're talking to people.
No, I mean, it's funny, when I was applying to medical school, I have 2 really dear friends who are physicians, but whom I met at an herbal conference. They came up to me after I gave a talk at Medicines from the Earth, and we became fast friends. One of them is one of my best friends, like 30 something years later. But I remember when I was applying, Jeff and Reed both said, "Hey, just be aware that when you do get that license, it's going to put you into a whole different kind of framework of responsibility and liability." And I mean, I definitely feel that, when I write things on my website, like what standards am I going to be held to? And it's a different standard than an herbalist would be held to, or a naturopath would be held to, or a nutritionist, or like a wellness influencer. People are going to expect certain things and certain accountabilities. And then I also just have certain like kind of licensing requirement issues that I have to be aware of. Like if somebody comes up to me on the street and says, "Hey, Aviva, um, I'm going through this, and this. What do you think?" Back in the day, I might have just been like, "Oh, you could try this." And now it's like, no, that's actually curbside consulting and I'm legally liable for it. So even as an herbalist, I became really thoughtful and careful about doing that in my neighborhood and my community because I didn't want to always be bombarded. But there's something different that you do that does shift when you get this different credential. So I agree and honor the truth 100% in what you're saying.
Do you ever I know that there's a lot of places in Europe where botanical medicine is very much more integrated into
Mhm.
their modern conventional systems. Is that something that you, talk about with colleagues or explore? Or in Canada, we're very similar in our perspective as you guys in the
Yeah.
States. So
I mean, I think it could be great to have I don't see having a system where there's like one tier where there are like medical grade botanical products and only licensed medical providers can recommend them. I think that would be terrible. Um, and I don't see a world anytime soon in which medical doctors or nurse practitioners or any of the licensed providers are going to have the capacity to have added into their education of everything they already need to know an entire herbal framework. I could see a world in which, certain herbs that are like really evidence-based might get integrated into the medical curriculum and say, "Oh, you have a patient who doesn't want to try an antidepressant but clearly needs something." you know, St. John's Wort's a great place to consider starting something if they want to try something. Um, and I don't see a world in which botanicals are treated as pharmaceuticals. I went to Cuba. My daughter was living there for off and on for several years doing an art study program, and she got a respiratory infection that was pretty significant. And she went to the local clinic, and the local clinic gave her a tincture of thyme. Actually, it sounds funny when I say it, tincture of thyme, but literally she had a tincture of thyme. It said Thymus vulgaris, whatever percent on the bottle. It was written like a pharmacy label, and she was prescribed that as her treatment. I don't see that here in the US. I don't see the incentivization or the incentive for pharmaceutical companies to create and patent and go through the entire drug discovery, drug approval process for things that people can grow in their backyard and tincture themselves. Um, it's just not, it's not there.
mhm.
So, yeah.
Yeah. Yeah, similar here with the regulations even around labeling our natural health products
Yeah.
here in Canada is becoming and keeps going through these changes that is
Mhm.
causing companies to not continue to
Yeah.
conduct
And
business
it's
here.
difficult. Like for me as a physician, while there were things that I would say I have given up in terms of certain, not given up, but like I'm more thoughtful about some of the guardrails that are around me in terms of my practitioner licensing. Um, I have way more latitude to treat way more people for way more things. Like there's basically nothing out of my wheelhouse unless it's not covered in family medicine. So whether it's rheumatology, severe mental health issues, autoimmune issue, I mean, like there's nothing, well, that would be in rheumatology. There's like nothing I can't work with people around for the most part. And the challenge is though, let's say I do have a patient with rheumatoid arthritis and I want a botanical product that is going to effectively and consistently address her inflammation and pain. and I'm getting different batch consistency on every bottle of something that I get from a company, that makes it more challenging. And I think that when you start working with patients with more complex medical conditions, that you do want some consistency and some reproducibility around your medicines, and that isn't always there, and that's challenging. The other thing is the risk for contamination and adulteration. So there was a study done, I think it was the correct me if I'm wrong, like the Toronto Sick Children's Hospital, I think it was what it was called.
Yeah.
Yeah, they had a program called Mother Risk, and one of the things that Mother Risk did was, assess, botanical safety, in pregnancy and breastfeeding, and there was a study that they had reported on or maybe even had funded, I'm not sure, it was a independent organization on echinacea use during pregnancy, and this study found that longitudinally, based on a retrospective study, that across any trimester, they did not find any mutagenic, teratogenic, or, negative impact on, babies born to women who had used echinacea at any point, even in first trimester. So historically, and for a very long time, I've told my patients that echinacea is appropriate and reasonable and safe to use for oncoming or active cold symptoms. But then I just got a bulletin from the American Botanical Council in their Herbalgram, I think it was, saying that there's now a known adulteration happening or contamination happening with echinacea, and some of those products that are making their way into echinacea, other plants, may not be safe for use in pregnancy. So while echinacea is safe for use in pregnancy, right now, I don't know that I can say echinacea products that you're just getting on the market are safe for use in pregnancy. So I can send someone to the local herbalist to get products, but then I don't know what their quality control is or batch consistency. So it's very complicated from a physician perspective with certain situations to be prescribing botanicals, even though that is my primary go-to still in my medical practice. But there are
Mhm.
nuances. There are nuances. So
There are
I'm not opposed to more regulation. I don't want regulations that prohibit people from making products in their communities, in their homes, and selling them to people who want those products. We also could use a really high level tier of products here that provide that reliability and batch consistency and safety and assessment and so forth.
Mhm. Oh, that's really interesting to hear. Yeah. Well, I know you've got another appointment coming
Thank
up, so
you.
keep you too long, but just
Oh.
on one note to sort of take us off, if you have any advice or just an empowering message about women navigating their health, reproductive health, especially through their life, what advice would you give to them?
Mm. Um, if you feel it, you know it. And that doesn't mean that if you think you have a brain tumor because you have a headache, you have a brain tumor. But if you're in a healthcare environment and you're not feeling respected or listened to or having your symptoms trusted, do not take no for an answer, right? Women should not go 8 and 10 years waiting for an endometriosis diagnosis because somebody dismissed their pain as just stress or just normal for menstrual cycles. Somebody should not go 4, 5, 6 years with Hashimoto's and fatigue and depression and weight gain and hair loss and constipation to be told, oh, it's just stress or normal fatigue because you're a mom or you're in menopause. So really, really trust yourself, find your allies, and keep going if you feel and know that you need that extra support. I think just trusting our guts, listening to our bodies is so important, and stay connected to nature. I mean, honestly, I got up from my computer yesterday, went out and picked rose hips. It was like transformative just to go out, step away, step out, connect with some plants, and make some tea. It was just better than anything I could have done for myself.
Oh, thank you so much, Aviva, for those wise words and for all the work you've been doing in
Thank
the health
you.
sphere. Really, it's we're so lucky to have a voice like yours among a lot of voices that are great and a lot that are difficult to know what to look for. And thanks again for taking the time to join me today.
Pleasure. Thanks for having me.